Hello, we are live. Using the new laptop, so we'll see if the audio is okay. Hopefully you guys can hear me. As always, I'll give it a little bit of time and then we'll get started. So, unless you guys didn't know, we are going to do a live on lower back pain today. We're going to focus on quite a lot in terms of how we as therapists sort of try to categorize this pain and make it a lot easier for you when you're trying to describe what you're feeling. It'll give you an idea about what we're looking for, and we'll finish with how we can deal with that pain as a patient as well. So I'll give it another minute and then we'll get started. Okay. Okay, right. So, when we're trying to understand lower back pain, we tend to categorize the pain types in order for us to better realize where it might be coming from, and in order to give us a better scope for when we do our assessment. So, when lower back problems happen, we tend to get three different types. Okay, we get a dull aching type pain that is mainly local to the back and mainly stays there. Secondly, we have a dull aching, gnawing, and what can sometimes be described as expanding pain, and that can move lower down into the glutes and into the thighs, but no further than that. I'll explain more about that later. And then finally, there's shooting, piercing, stabbing pain that can follow a pattern all the way down to the feet. So let's break each of those different types down. The first one, dull aching pain, is what we would describe as nociceptive pain. What nociceptive pain is, it's one of the two main types. You have nociception and you have neuropathic pain. Nociception is the most common type, and what this is caused by damage to the tissues of the lower spine. This can be done via trauma, such as a fall, or mechanical, such as lifting with improper form, leading to a strain, or joint overuse and damage, which can lead to arthritis. With there's nociceptive pain, there's receptors that are nociceptive receptors that are next to quite a lot of the structures within the lower back and throughout the body, but it's usually next to the joints that the nociceptive receptors are at. So it's important for you to understand that we can take a educated deduction as to where the pain might be coming from, but it's near impossible to pinpoint a specific location. And it's important to keep this in mind when you're trying to work out exactly, it might be this vertebrae, might be this joint level. It doesn't really work like that. You can't specifically pinpoint where that is just by sort of looking at the pain pattern. Pain pattern doesn't directly relate to location, if that makes sense. And this leads me on to the second point, which is the dull aching, on top of that the gnawing and expanding that can move into the glutes and thighs. That's what we call somatic referred pain. And this is when structures that go beyond the location of the lower back then become affected by the lower back issue. So when I mean expanding, you can sort of describe that as a pressure within the back that can move to the glutes, and it can also move to the thigh. And that's likely what we see as described by some of our clients and patients. And it's not a stimulation of the nerve roots, but rather the joints which are linked to the vertebrae, which we call the facet joints, which are the back of the spine, the sacroiliac joint, which is in the pelvis, at the back of the pelvis that connects the tailbone to your pelvis. And finally, and sort of most commonly out of the three, is the disc. You can get pain, discogenic pain, which is sort of caused by compression that you can get at the vertebrae levels. I say that it goes, this type of pain goes no further than the thighs. This because it doesn't really follow a nerve pattern. This pain can be quite widespread occasionally, but it's more commonly just within a certain area, so it doesn't follow the way the nerves do, like the branches of a tree. It just stays in around an area, but doesn't go further than that. This leads me on to the last type of pain, which is the shooting, piercing, stabbing pain. And this is what we call radicular pain, or the second type to nociceptive, which is neuropathic, which means involving nerves. This pain is caused by irritation of nerves that neighbour the spine. It's most commonly a result of what we call disc herniation, which you may have heard before as a slip disc. It's improper to say it's a slip disc because the disc doesn't actually go anywhere. It doesn't slip out the way. It's just a bulging, and that's what the herniation means, a bulging. And what this type of pain usually travels down in a band 2 to 3 inches wide, that, as we can describe, which shows the same patterns of a nerve. It's impossible to determine the exact nerve route based on the trajectory of the pain, which is quite a common belief, but we can make sort of an educated deduction purely based on what we call a dermatomal pattern, which is sort of when we look at our skin, there are nerves that connect it, and when we test the skin sensation, we're following what's that nerve pattern, that dermatomal pattern. If you think of dermatomes as like a dermatologist, it involves the skin. So if you remember it that way. What can develop from this radicular pain, i.e. the nerve pain, is what we call radiculopathy, which is a progression of that, where it gets worse. And that's it can mean a group of symptoms because of the blocking of nerves at their roots. Alongside the pain, there can be weakness, numbness of the skin, pins and needles. And if someone were to come in with all those things, what we do is we'd have to do a full assessment, which we call a neuroscreen, just to check whether at that level of the spine there's no nerves being blocked, which can actually be what we call a red flag, which is something that is quite serious and might need referral to a general practitioner or further into A&E. So to summarize out of what I've said, the 3 types of pain are nociceptive pain, which is dull, aching and local; somatic referred pain, which is dull, aching, expanding, gnawing, and can shift to neighbouring tissues; and the last is radicular pain, which is lower back pain as a result of trapped nerves. So in order for us to describe the pain, these are the types of things that we are looking for. And when clients are struggling to describe how they are feeling, this should give a better scope as to what you can potentially describe your pain as. And that way, it's a better way for you at home to understand where your pain might be coming from and how serious it could potentially be. Now, we'll talk about the methods that we can do to deal with this pain, and sort of 3 common either misconceptions or things that people don't do that we notice when they come into the clinic. So a lot of the time people feel if they've got more of a serious injury, such as the trauma I mentioned, or the trapped nerves, what patients can think is, oh, let me avoid that type of pain by doing nothing and staying bedbound. And a study was done that looked at patients that have serious lower back injuries that require surgery, so such as the disc herniation that I mentioned, the trapped nerves. It took half the time to fully recover if patients were up walking around the ward compared to patients that stayed in their beds. And that tells you that you should not be afraid to move. Often patients feel as though pain would mean that you'd have to rest or you need to be bedbound, but this is not the case. It's important to avoid bed rest and get up and move around, because you cannot do any harm by doing that, and it's proven that you can actually benefit from that. So it's important to think pain, it may be almost excruciating, but you are still able to move, and it's important that you do so. Secondly, a lot of the time with lower back issues, you notice poor posture that comes with that, and that could be a result of sitting in an office, or perhaps if you go to the gym often, you are practicing form incorrectly. So in order to rectify that, you have to stay constantly alert in terms of the posture. Be upright. Cushion chairs are better than hard chairs when it comes to lower back pain, it's been found. And this also relates to sleeping. So in terms of posture when you sleep, don't sleep in a way, for example, on your front is not beneficial for you. You should either be sleeping on your side or back, because that's more of a natural position and your spine's not in a shifted position away from what's anatomically normal. So what we need to be doing is sleeping with a naturally curved spine, and one way that we can do that is using cushions and placing pillows in a certain way to remain level. Sleeping on your front can be bad because of the fact that in that position gravity affects your pelvis. So if you imagine you're lying flat here, and you're face down, the pelvis is going to sort of drop, and that can add to stress on that lower back. So that's why we either want to be on our back or sides, and on our side is actually the best for that if you experience a bit of that pelvic tilt, so that twist of the pelvis. Thirdly, is most important thing to do is to relax when it comes to the lower back pain. Stressing about the pain and working a stressful job is important to relax, and that's been shown that people will end up with less pain if you can get rid of the stress that can be caused by this pain. So it's important to think about all 3 of those things: be mobile, improve your posture, and just relax. And those things, on top of adhering to exercise that is given to you by a professional that is going to give you the best exercise for what specific injury you have. That's going to focus on, for example, if someone has poor hip mobility, they'll focus on that more. If it's something that's really joint related, they will focus on alleviating that joint pressure. It's important to really listen to what exercises have been displayed to you as beneficial and to do them consistently. But the things that you can just do at home without having to think about it is the mobility, the posture, and relaxing. So, summarize, pain types of lower back are important for you to consider and important for you to understand what's going on, so you have a better understanding of how you can improve that pain. And also there are ways that you can deal with it that aren't too strenuous. So, thanks a lot for coming to live, and hopefully you learned a little bit about how the pain mechanisms work. And I hope everyone has a great Christmas. Okay, thanks for coming along. I'll leave a couple of minutes for questioning, if you have any. Okay. Thanks a lot for coming, and have a great Christmas. Bye.